Okay. Right, left and right lung. Each lung has lobes separated by the fissures. The right lung gets 3 lobes: superior, middle, inferior lobe. The left lung only gets 2 lobes: superior, inferior. The lines that divide them are fissures. Oblique means diagonal, so that's the oblique fissure. There's the oblique fissure for the right lung. The right lung also gets a horizontal fissure because we have 3 lobes. So starting up here. So this is where we start with the larynx. So there's the hyoid bone. That flat cartilage is the thyroid cartilage. The next one down is the cricoid cartilage. And then here's where the trachea starts. Each one of those is a tracheal cartilage. The trachea comes down here into the chest, and behind the heart, it branches off into 2 primary bronchi. So there's a left and right primary bronchi. The diaphragm is the muscle that sits at the bottom of the lungs. All right, so we'll look at this one. So same thing, minus some of the stuff. So hyoid bone again, there's the thyroid cartilage, the big flat one. The cricoid cartilage makes a ring all the way around. And then here's your trachea again. On the back, that little cartilage right there, that's the arytenoid cartilage. The musculature on the back of the trachea is the trachealis muscle. And if we open it up, you can see the vocal fold right there. And this is actually the epiglottis, but it's better on the other model, but there's the vocal fold there. When we look at this model, we can see those structures. So there's the external nares, the nostrils. There's the 3 nasal concha: superior, middle, inferior nasal concha. This tube right here, that's where the pharyngotympanic tube exits into the throat. So that's the pharyngotympanic tube. There's a little hanging down at the back of your throat. That's the uvula. This thing that closes there, that's the epiglottis. And it closes here. The hole is the glottis. And so the epiglottis closes over the glottis to prevent food from going down the airway. So when you swallow, it pushes that down so that food doesn't go into your trachea there. So then we have their different regions of the pharynx. So from the back of the nasal concha here to the uvula, this region is the nasopharynx. From the uvula to the epiglottis here, so the back of your mouth, there's the tongue, there's the back of your mouth, the back of the throat, this is the oropharynx. And then from the epiglottis down, this is the laryngopharynx. So nasopharynx, oropharynx, laryngopharynx, in that order. I think that's all your structures.